I'm Eric Yonker. I'm a pediatric otolaryngologist at Northwell Health in New York and associate professor at Hofstra University. And I'm going to be talking a little bit about loss of autonomy and job threat. And are the robots coming for our jobs? The answer is yes. I have some disclosures, nothing really relevant to this talk. I do use some items for under copyright under education use. So are the robots coming for our job? Are the robots going to medical school? Sort of. So surprisingly, if you look at the Forbes top 10 list of professions that are under job threat from big data, healthcare was number one. Granted, this was in 2016. But some of the futurists, as we talked about yesterday, are talking about that healthcare should be worried that essentially half of all the jobs in the next decade in healthcare may be washed away. I asked ChatGPT, I said, do you think that all these jobs will be taken away? They said, don't worry, AI is not going to take all of our jobs. It's a little bit like Space Odyssey 2001, if you don't remember. HAL took over and killed all the humans. I don't think that's going to happen here, but obviously a lot of certain specialties are definitely worried, and we'll talk about some of those. A lot of people are likening this to the Industrial Revolution. When a lot of jobs obviously got lost, and when the Industrial Revolution happened, then everybody either changed jobs, lost their job, or jobs got created. And I think the same thing is going to happen in the age of AI. And if you actually look and actually compare the Industrial Revolution to what we're seeing in healthcare, there's a lot of different things that are happening, but you see a lot of parallels here. You see a lot of short-term effects on the workforce, long-term effects. Definitely there's going to be some skill shifts that we're already seeing, that people are starting to have to get used to working with AI, not necessarily be a coder themselves. But the big thing that I'm really worried about is the impact on professional autonomy. As Rakesh just talked to you about, the shift of clinical decision-making to an AI system can be grinding on some people. Especially, you're in the emergency department and there's a chest pain algorithm, most of the stuff is taken out of your hands for some things as to whether you monitor troponins, if there's a head CT for certain head trauma. There's a lot of things that are going to be sort of suggested by the AI, and there's also going to be some problems when you try to go against the AI, and Rakesh really talked a lot about that. There's obviously economic outcomes, how funding is going to get shifted. There's going to be a lot of funding that's going to be funneled towards AI, and what does that mean for frontline workers, and what's about their jobs? There's obviously going to be resistance to technology, just like a bunch of doctors retired when the EMR came out. The same thing's going to happen when the AI comes out. Even us, we're going to Epic this year. There's a lot of doctors who are choosing to retire instead of going to and learning Epic. There are equity concerns. This was talked about yesterday at the symposium, that it is a large investment to get an AI system into certain health centers, and not everybody can afford that. And Marcos talked about how they're making it open access because they truly feel that some of these innovations should be available to those who are less well off. And the pace of change is going to be rapidly faster, so much so that we talked about yesterday that all the legal and policy decisions that are being made are already behind the times. There's journals out there that still haven't decided what their policy on AI is, and I think hospital systems are all scrambling to figure out what's going to be the actual implementation. There are key differences, though, and so obviously the difference was in the Industrial Revolution it was physical labor, but now it's cognitive labor. And Rakesh really talked a lot about that and how that's going to shift. It's going to be way faster than the Industrial Revolution. We're already seeing changes. We talked about it yesterday, the difference between the AI knowledge in the room in the symposium yesterday versus a year ago, let alone 2 years ago, was so much different, and people are so much well versed in it. It's going to be relatively ubiquitous and very fast, to the point where we're going to be somewhat uncomfortable with how fast AI is being integrated. This is a very regulated, high-stakes environment, as opposed to the industrial workers wasn't as high stakes as we are. We're dealing with patients and life and death. So one thing that AI is really, really good at is pattern analysis and image analysis. So some of the jobs that people do from a health professions standpoint are at threat with this, because obviously radiologists and dermatologists, you can see this was back in 2020 and 2019, before really a lot of the AI systems that we see now are really in use. And so they were actually already starting to worry about job threat and trying to think about, okay, what do we accept the AI? Do we try to fight the AI? Fighting is useless. So the robots can do a lot of tasks that we do. So this was actually an all-in-one sedation machine by J&J that actually provided anesthesia for colonoscopies. So you didn't need an anesthesiologist in the room. We could talk about the legal ramifications of that. But this actually was quickly scrapped. And the reason why it was scrapped was because when it was a straightforward patient with a straightforward medical problems, it was able to do that algorithmic medicine and try to give the medication. But when you went off script just a little bit, the system couldn't handle it. So we still need doctors. We still need people to take those jobs because there are still these more complex patients that we take care of that really don't fit well, at least with the algorithms of today. As everybody said, the AI used today is the worst AI you're ever going to use, so things do get better over time, but I still think there are human skills that we will still have. The surgeons in the room, such as myself, are always like, oh, we're safe, they're not going to do surgery. Well, so it is doing some surgery. There is a robot that does cochlear implant surgery, which is some of the things that I do. And it can do it very precisely, a very small opening. But again, there are major limitations with this. Again, when anatomy is not quite right, when there are things that it can't figure out, then it still has a problem with, at least with the AI of today. And so nursing is not in any safer space for certain things that they do. And so this article came out, wonder if my years of training and expertise will be devalued by machines. And this was in open access for nursing in 2024. I bring this up because some of the framing that they put in this was a qualitative study that actually looked at how nurses felt about the implementation of AI and the effect on their job. And the summary, the code book that came up was actually very apropos to what we're talking about today. And they really talked about some of the ethical and moral dilemmas, job security and insecurity, if you will, how their workforce is going to change and redefine what they do. And they talked about the trust and acceptance of AI. What is the policy and regulation to be around AI at the front line? And the patient-provider relationship, how's that going to change? When it first came out, everybody was worried that AI was going to take the human away from the patient. But people who've used AI scribes and some of the people who have been liberated by the keyboard have said that actually they can engage with their patients more. And studies have actually shown that people that are using AI scribes have a better connection with their patients, and the perception from the patients is that they have a better control of the doctor's attention as opposed to what they had when they were tied to the keyboard. And then obviously quality is going to be a big discussion, and return on investment and quality of care are going to be big discussions about the implementation over AI. And you can go through some of the codes that they did, but you can definitely see that job security was one of the main themes that came up. And people were worried about certain jobs, and we'll talk about some of the administrative jobs that are going to be maybe changed, maybe eliminated. And obviously there's ethical and moral dilemmas that Rakesh really talked about very well, especially when it came to the frontline decision making. There's lots of different things in here that I think are very important for us to discuss. So just like with the Industrial Revolution, there are going to be certain jobs that are going to be lost. There are certain jobs that are going to change or transform, and certain jobs are going to be created in the age of AI. So we don't want to discourage anybody from an education standpoint to go into any of these roles, but there are definitely eyes wide open as you go into this. There's definitely these repetitive tasks like administrative roles. There's AI that's doing billing and coding, so it actually goes through and calls through the op report or through the clinical notes. It can actually do automatic billing, and then the doctor actually just checks it and says, okay, that looks good. So there's a lot of things that we can do with AI that may be more efficient, which then means that there might be fewer coders and billers that they might need. Scheduling tasks. There's actually an AI that can actually watch the operation and actually generate the operative report. So you actually don't even have to do the op report. So all the transcriptionists that are transcribing the operative reports, maybe those roles will be lost, or maybe those will be changed. There's a lot of AI that's doing pre-screen for radiology. So there's actually triaging of radiology scans. So it pre-reads them and says, okay, this is a pneumothorax, this is a head bleed. You should read this first of the 1,000 scans that were done. And there's also even AI that is predetermining certain imaging. So actually it does next nearest neighbor. So it can actually reduce the time of MRI, but then it can actually predict whether there's problem areas and rescan the patients in those areas. We talked about billings and claims, and obviously a lot of people are using AI scribes. Just out of the curiosity, how many people have used AI scribes? Raise your hands. Not a lot. So it's coming to the U.S. pretty hard. Epic actually just announced, I think yesterday, that they're going to have an AI scribe built into their system, which is one of the biggest EMRs in the United States. So administrative jobs do take up 1/6 of our jobs, and so I think one of the things that we're going to be advantageous for the AI is all of these administrative tasks, all these things, billing, transcribing, documentation, these things that really lead to burnout, physician burnout, may be removed, but then the jobs that are associated with those might be going away as well. There are a lot of jobs that are going to change. Rakesh talked a little bit about the physician AI dyad that's going to happen at the point of care. We already talked about radiologists, nursing roles, so some of the monitoring and the vital signs and things like that are going to be sort of changed, and it's going to be a much more supportive role in that way. The educator's role, we talked a lot about yesterday about the role of AI in the health professions education and how that role is going to change. And then obviously the administrator's role is going to be more an oversight and overseeing some of these AI implementations. There will be plenty of jobs that will be created. So people are going to have to train on AI. They're going to have to train the AI to actually be at the point of care. There's going to be clinicians who are going to have to enable that training. There's definitely going to be AI health supervisors, going to be ethic and moral AI folks that are going to have to oversee some of the things that Rakesh talked about to monitor AI, to make sure that we're using it ethically, to make sure we're using it morally, and then obviously overseeing the data sets, the big data sets that are determining some of these outcomes. And all these digital health navigators that maybe for patients that maybe they need help using their AI if they have AI-enabled health records. So there's a lot of jobs that will be created. But a lot of people think that AI is going to be the good part. There are lots of things to be concerned about, but ethics and equity, I think, is a big discussion about implementation about AI at health systems, especially those that are less economically well off, may not be able to afford some of these, at least as it is right now. So I think there's a lot of things that we need to really think about. And this degradation of skills is real. In surgery, which is the example I give here, we've seen a massive degradation of skills in the age of laparoscopic surgery and general surgery. In fact, if you trained in an institution that had more than 50% of your cases laparoscopic, those have a very low self-efficacy for performing open surgery. So all of a sudden now we're graduating surgeons that don't know how to do open surgery. Well, what happens when the laparoscopic equipment breaks? The same thing's going to happen. The same concerns happen that, he talked about the Medicare decline and all these things. What is the reliance on AI going to do for our skill development? And what are those skills that are going to be evergreen that you're going to need regardless when the technology doesn't work? I don't think the robots can be graduating medical school anytime soon, but I do think that they're going to be working alongside us, and I think the future is this dyad. Whether or not you believe Eric Topol's quote, which they talked about yesterday, is those who use AI will take over those that don't use AI. But I do think that it is a dyad going forward. And we do see that in the evidence that actually working side by side with AI is best than either alone, at least for now. That may change as the models change. With that, I appreciate your time and thank you so much.